First at 5, millions of free at-home COVID tests from the U.S. government are arriving in Americans' mailboxes. However, the accuracy of those rapid tests are being questioned, with many getting a false negative. Eyewitness News reporter Jeremy Baker with how to make sure you know when to use them and when you'll need a backup test.
Experts say rapid tests are about 70 to 90% effective, but many people say they are getting a false negative, then testing positive a day later, especially among those who are vaccinated.
Despite the fact that vaccination is highly successful in preventing serious illness and death, it may be that the antibodies begin to work early.
In other words, people are taking the rapid antigen tests too soon.
When it comes to testing, the accuracy and the sensitivity is best with the antigen-based test when you're right in the middle of the infection.
A small study by Yale, Cold Spring Harbor Laboratories, and BMJ of 30 people who took the rapid test daily during the beginning of the Omicron surge in December found that those people were infectious several days before the virus was detectable by the rapid tests. A larger study of 731 people who used the Abbott Binax Now rapid test kit found that it performed just as well with the Omicron variant as other variants, but only when those people were symptomatic with high viral loads.
If you're trying to say, hey, I've been exposed and do I have an infection that's building, then you do rapid tests, over a 12 or 24-hour period, multiple tests. And, after you've gone through 3 or 4 of those cycles, you can be pretty certain that you didn't get infected.
On the Community Lab's website, you can find their COVID-19 test comparison. When you scroll down, it compares the differences in the accuracy, detection method, test administration, and turnaround time of rapid tests versus PCR tests, as well as other frequently asked questions. We have the link with this story on KENS5.com. Jeremy Baker, KENS 5 Eyewitness News.
The World Health Organization says we can't let our guard down yet, but the Omicron variant offers some plausible hope to get back to normal. The surge is loosening its grip on the Northeast, but has yet to peak in other areas in the U.S., especially where vaccination rates are lagging. The surge forced nearly 4,500 schools to cancel in-person learning for at least one day last week.
We're never really going to get to herd immunity as long as only 2/3 of the country is vaccinated. We really need to get to 85, 90%.
Right. Meanwhile, starting today, Americans can start picking up free N95 masks from local pharmacies. Millions of masks arrived today at some stores, with more on the way in the coming days. Up to 3 masks are available per person. The White House says masks will also be available at community health centers. And now to the latest COVID-19 numbers in Bexar County. Metro Health reporting 7,023 new cases today, along with 3 more COVID-related deaths. There are now 1,257 patients hospitalized.